Okay, so now that I have taken your history and examined you, I want to give you a brief explanation around how the neck and jaw function in a very interdependent way, so that you understand some of the symptoms that you're experiencing and then the treatment that we're going to be providing you. So first of all, let's have a look at the temporomandibular joint, or TMJ. And TMJ is the name of the joint, not the condition. Conditions involving the TMJ we refer to as TMD, or temporomandibular disorder or dysfunction. The TMJ is made up of two bones. The temporal bone of the skull, you've got one on each side of the head, that forms the socket for the joint. We call that a fossa. The corresponding bone is the mandible bone, which ends at the back in these rounded projections called the condyle. And the condyles are shaped to fit into the fossa or the socket. So it's a shallow ball and socket type of arrangement. Two things make this a unique joint in the body. Number one, you only have one mandible bone that serves both the left and right jaw joints. So in effect, if something is happening on one side, it's going to impact what's going on the other side. The second thing that makes this a unique joint is the fact that there's teeth at the meeting interface, which is why there's sometimes an assumed dental connection with TMJ problems. And we used to think that that TMJ problems were related to somebody's bite. We know that not to be the case. There are certain bite types that might predispose to TMJ issues, but TMJ issues are much more a result of overusing or misusing the structures around the temporomandibular joint. So it's a musculoskeletal injury, and that's why we would get lots of dental referrals once the dentist has ruled out a dental cause. So showing you inside the jaw joint, we've got the temporomandibular disc, which is like the cartilage of your knee or your meniscus. It's there to keep the bones apart and to prevent wear and tear, so it acts as a cushion. And attaching to the condyle and the disc is this deep double-headed muscle called the lateral pterygoid muscle, which is, we haven't touched that yet on you today because it's deep inside your mouth, so we'll be feeling it a little bit later. But essentially, this muscle plays an important role in the opening of the jaw, which we're going to look at in a moment. So just to show you how this all fits together, this is how your head sits on top of your neck. So this bone at the back here is this occipital bone. So in a very small area we've got the TMJ, we've got the ear, which is why it's not surprising that people will manifest ear type symptoms like blocking, aching or ringing. And for that reason, we get a lot of ENT and GP referrals once they've ruled out an actual ear cause. And then over here, we've got the start of the neck. So this first neck vertebra here, called the atlas, is what I first touched you when I touched your neck over here. So what we can see is that there's a lot going on in a really small area, which all is interrelated when we open and close our jaw. Now, the average amount of opening of our TMJ is around 45 to 50 millimeters, which is roughly the equivalent of 3 fingers between our teeth. And opening is divided into 2 distinct phases. The first phase is called hinging. This is where we're looking. In the hinging phase, the mandible drops down, and to a lesser extent, the skull tips back. And that accounts for around 30 millimeters of opening, which is the equivalent of about 2 fingers height. So if this is the back of the skull, there's got to be sufficient space and mobility for that skull to tip back into in the hinging phase. And we call that the functional space. And more often than not, people that come to us with TMJ problems don't have good functional space because they have forward head posture, which is what you have. And when we have that forward head posture and we compress the space, that's creating stress on the TMJ right from the beginning of the hinging phase. Not only that, but when that functional space is compressed, you're also going to have some symptoms that are coming from the neck, such as brain fog, lightheadedness or dizziness, headache, neck stiffness or neck pain. So you can see there that the posture is very much implicated in creating stress on both the neck and the jaw. Now, going back to the opening, what we said was that the first phase was hinging. Now, if we were to hinge the whole way through that 45 millimeters, we would compress the structures behind the back of the jaw and the skull over here. So what happens is when we get to around 30 millimeters, a second phase starts to occur, and that's driven mainly by the contraction of that lateral pterygoid muscle. And what we know is that when muscles contract, they shorten, and so that lateral pterygoid muscle will help to pull the condyle and the disc forwards and down out of the fossa like this. So on the skull it will look like this. So we've got our hinging and then we've got our translation. Okay, and that phase is called the translation phase. Now, because the mandible is one bone, if this is the mandible and this is the left and right TM joint, theoretically both sides should move at the same time and they should move symmetrically, but that often doesn't occur. And the consequence of that is one side will move more than another and will be subject to more forces. And that can cause aching in the joint, or it can also cause a destabilization of how that disc is sitting on top of the condyle, which we'll look at in a moment. So just to give you a better idea of what goes on inside the jaw joint, we're now looking at the jaw from the opposite aspect. So we're looking facing this way, and we're going to look at this square here enlarged. So over here we've got the ear at the back, we've got the fossa in the skull, we've got the condyle of the mandible. Over here we have the bow tie shaped disc, and we have the lateral pterygoid attaching to the condyle and the disc. This yellow tissue, which we haven't mentioned yet, is called the elastic lamina or elastic layer, and it plays an important role in helping us close the jaw, which we'll look at in a second. So what we said was that in the hinging phase, the skull tips back and the mandible drops forwards, and that gets us around 30 millimeters of opening. When we need to open more, the lateral pterygoid muscle contracts and shortens, and it pulls the condyle and the disc together as a unit down towards this point here. So that looks like that. At that point, the elastic tissue stretches and allows that to happen. And then when we close, the elastic tissue will recoil and pull the condyle and the disc back into the fossa. And that is the normal opening and closing mechanism. Now, finish this here.